Alameda County Community Advisory Group CAG meeting. And we are going live to YouTube in a few seconds. Okay, we are now live. So my name is Maria Dominguez, and I am from the Alameda County Public Health Department Health Equity Policy and Planning team. I'm filling in today for my colleague Lauren Baranco, and you are tuning in to our Tuesday, July 13th, 2021 Alameda County Vaccine Community Advisory Group meeting. So welcome everybody. We're going to present some instructions, some accessibility instructions so that everybody can tune in. So I am going to ask one of our interpreters, Annabelle, to please give the instructions for Spanish language interpretation.
Buenas tardes a todos. Esta presentación va a estar disponible en español a través de interpretación simultánea. Entre unos momentos vamos a activar el módulo de interpretación y en ese momento verán en la esquina derecha de su pantalla a un icono con un globo terráqueo. Van a seleccionar ese icono. Y al seleccionar ese icono van a ver el idioma español o va a decir Spanish. Van a hacer clic en eso y luego van a seleccionar Mute Original Audio o desactivar el audio original para solo escuchar en español. Si está usando un teléfono inteligente o tableta, van a ver el globo terráqueo o una manera de acceder a interpretación bajo la sección que dice más, more o 3 puntos y verán entonces la opción para interpretación de idiomas y harán lo mismo, seleccionarán su idioma y van a desactivar el audio original. And if you are presenting and joining in English, you can also select English under the globe that will appear shortly at the bottom right hand of your screen. And this is so that if something is said in Spanish, you will hear the interpretation in English. Thank you.
Thank you, Annabelle. So now I'm going to hand it over to Ben Chen to give some instructions on additional accessibility features.
Thank you, Maria. So we also have closed captioning available, as well as live ASL interpretation. The ASL interpreters, Pamela and Katie, are both spotlighted on the screen, so you won't have to do anything for ASL interpretation. For closed captioning, you can click closed captioning in the controls, which will be at the top or bottom of your screen. After selecting closed captioning, you should see it pop up on the bottom of your screen. If you need to adjust the size, you can go into your settings, select video settings from the panel on the left, and select accessibility. And you can slide the slider to adjust the caption size.
Thank you, Ben, and thank you to all our interpreters and captioner this evening to make our meeting accessible to more Alameda County residents and guests. So next screen, please. So now I will turn it over to one of our co-chairs, our Community Advisory Group co-chairs, Greg Hodge.
Cool. Thanks, Maria. I want to welcome everybody to this conversation. We have a full agenda today, and as we always do, we want to take a moment to acknowledge the land that we're on as we sit in the Ohlone country, and all of our Native American relatives. I want to thank them for allowing us to be in this space. We also want to acknowledge our ancestors, whatever community we come from. There were people who came before us who put in a lot of work and effort so that we might be here today, and we don't take that lightly, as well as all of the children who are yet to be born. We're really excited for Lauren Baranco and her family. Lauren had a baby since the last time we all talked, or maybe it was 2 meetings ago. And thank you, Maria, for stepping into that role. It's a little nerve-wracking, I'm sure, but thank you for that. I want to remind folks to speak clearly and sort of deliberately, so our interpreters can catch everything that we're saying and everybody can participate in this. So on behalf of Nestor Castillo and Kimmy Watkins-Tart and myself, I want to welcome you to the conversation. If you're a new participant in this, we invite you to go to the chat and tell us who you are, give us your name and your organization if you represent someone, and anything else you want to say by way of introduction. We're going to have partner updates today, and we'll have a lot of updates around the county vaccine, some general updates, children and youth strategy update, as well as ongoing COVID response. And then we'll be able to close out. And all along the way, we'll open up for questions and comments at appropriate moments. So with that, I think I have handled what I'm supposed to do today. There are lots of voices here. We're glad you're here with us. We're glad you're staying safe and healthy. And I'm going to pass this over to Kimmy Watkins-Tart, one of my colleagues, who is our Public Health Department Director, who does not have the ability to give Anika a raise, but is the person who has really been leading a lot of this work. And Kimmy, we really appreciate you, sleep deprived or not. So please, Kimmy. Uh-oh, where'd she go? Did we lose Kimmy?
Kimmy is still muted, so.
You're muted.
Sorry.
There we go.
I was just asking if there was a slide for this part. No. Okay. So at this part, so we would like to invite any of our partners to share with us some of the work that you have been doing along the way with regard to vaccine. There are several of you who are engaged in work to vaccinate segments of our population, and some of that work we've done side by side. And so we'd really like to hear from some of the wonderful work that you've been doing. So I will pause to, if you want to speak, I think you can just raise your hand. Yes. Dr. Rhodes.
Hi, everybody. So Umoja Health has been low on demand for our pop-ups, so we really have downsized things, and we did get the contract for mobile vaccination, so that's going to make what we've been doing official. But we have been doing our stationary site in East Oakland at Center of Hope every Thursday, and then at Corey in North Oakland, where we capture the African immigrant population, every Friday. But then in addition to that, we've been continuing to go back to a house near North Oakland, where we do what is called the Vaccination House Party. And we've captured some people just who were walking by for first doses. We, for second doses, some of those folks weren't able to make it to our stationary site. And so we found them in their neighborhood and vaccinated them right there on the scene. We bring 2 chairs, we do the vaccination, then we, hang out with the person. It's been quite interesting to have neighbors come out and say, like, what's going on? We're just trying to really be very visible in the community. We also went to someone's place of work because we knew where he worked and we knew he was going to be at work because he couldn't make it to our site. So we just went to his job place. We told his employers what we were doing. They let us in, and then we asked them to let others inside know if they weren't vaccinated that we had doses that we could provide. That was actually at a cannabis dispensary, so that was a little bit interesting. And then we've been to skilled nursing facilities, and we've been in people's homes. And so I just got a call before I got on here that we've got another 5 people first doses who are coming now through our portal, where we're inviting folks to give us their addresses and invite us to come vaccinate them at home. And we've connected with the Center for Elders Independence. And so they're funneling quite a few of those calls to us. We're working now with a youth advisory, building a youth advisory that we hope to dovetail with the youth advisory that is being built through this advisory group, working with TWERI, but then also with a number of different organizations, Youth Uprising and Reverend Cheryl Ward Ministries, to start having what are called, I just learned this term today, kickbacks, which is where the youth like to hang out at kickbacks, and then you do fun things at the kickback, and we would also be offering vaccine information and vaccines. So that's the Umoja Health update as we transition into I think what's going to be the hardest part of really getting us to the level of vaccination that we need to be in Alameda County.
Dr. Rhodes, for the benefit of everyone here, could you please tell us what CORI stands for?
Sure. CORI is the Children's Hospital Research Institute. It's the old Samuel Merritt College building on Martin Luther King around 56 to 58.
Thank you.
All right. Thank you, Dr. Rhodes. Gabriela Galicia.
Thank you, Kimmy, and good evening, everybody. My name is Gabriela Galicia. I'm the Executive Director of Street Level Health Project, and I just want to share some of the work that we have embarked since the beginning of June. So you heard me talk a lot about in these meetings prior about the barriers that day laborers and other community members face to getting vaccinated, and one of the biggest reasons is missing a day of work. So we embarked on this partnership with the Public Health Department and the HEP team, and we're really grateful for that team to support our vision about getting to the street level, literally at the street level, to get these vaccines to the community. And so as of this week, we hosted 3 different events in which we have been able to reach not just day laborers, but also community members that are on the ground. A lot of outreach and education has gone into this. So our strategy really has been to, target the neighborhood in which we are hosting these pop-ups and just giving as much information throughout the week and the day of. And right now, the number that I have for the events so far, and this is including second doses, we were able to provide all 3 vaccines thanks to La Familia's partnership in bringing the vaccines, and we provided 441 vaccines so far in just the 3 events that we've been able to do. And it's been really important to note that the education is really key up to the point of vaccination. And so we're just pulling people off the street, talking to people and engaging them right then and there. Many of the community members that were not, invested in coming to getting vaccinated, we were able to talk to them on the spot. And so a lot of what we also heard is that Sundays is a really great day because it's the day of, many people are resting, are, taking the time to do their chores, going shopping, other things, going to church. So they feel like that's an easy day where they can come and get vaccinated. And I'd like to pass it on, if I can, to Aaron to speak a little bit more about this as our partners.
That'll work. How you doing? Aaron Ortiz with La Familia. Great to be here. Gabriela, thank you for sending me the link. I think this really speaks to the culture competency and just really knowing the community on the ground and the reason that we've been able to be successful. I definitely want to thank Alameda County Public Health, Kimmy, your team, your soldiers on the ground, Paula, Basi, I know Gabriela would say the same. We've had other, members of our partnerships help out and come in, such as, homies, but also just seeing what we've seen with street level and having staff that, speak mom and understanding what it really takes to be able to convince. I mean, magic has happened out there. We've been able to really provide education and outreach through some of those efforts that street level does and combat against, vaccine hesitation, literally on the street for that to happen. It's been magic. So I definitely want to thank all of you for that, where that partnership has taken place. In addition to that, definitely the La Familia staff and being versatile, having to come on site from the very jump start and providing 3 vaccines at one time. And what I mean by that is 3 separate vaccines. Johnson & Johnson, Pfizer, and Moderna. I think that's been a benefit. And also just making sure that we learn along the way, both from street level and public health. We have best practice meetings. I love the quality that we're seeking to be, block by block, because we're really talking about improving systems, whether it's our EMR system and how it goes in the care system, how we get the data. That's been extremely just a blessing to have with this partnership. So I can't thank street level and public health enough. So thank you.
Thank both of you for all of your good work. Ralph Silber.
You're muted, Ralph.
Hi, I'm Ralph Silber with the Alameda Health Consortium, representing the federally qualified health centers. So our folks are doing a lot of the same things that Aaron and Gabriella and Dr. Kim spoke of. So lots of pop-ups, this idea of essentially taking the vaccine to where people are otherwise, instead of waiting for them to come to us. So just a laundry list of where our health centers have done pop-ups in the last few weeks. At Juneteenth celebrations, the Oakland Coliseum flea market, which I thought was a great idea because a lot of people go to the flea market. Going into parks, the Korean Community Center, the LGBTQ Center in Oakland, Lake Merritt, public housing facilities, block parties, faith-based organizations. So just like the other partners have spoken to, we're clearly a place now where we can't rely on people coming to us, but we have to take the vaccine to where people are in the course of their natural day. The other category that we're putting a lot of effort into is getting to the younger people. Folks probably know that the 12 to 16-year-olds are the group that has the lowest vaccination rates. So working with schools in all their forms, middle schools, high schools, community colleges. We have a lot of school-based health centers that we're using as ways to get to people, and trying, especially as we get ready for school to return in August, trying to use that as a way to get to people. And then, as other folks have mentioned, literally going door to door, knocking on people's door, offering them the vaccine. Some really interesting family events, offering puppet shows and bingo games as ways to get people out, and then trying to talk to them about getting vaccinated. And then also building it into our regular medical visits. So if someone's coming into the clinic for a medical visit and for some reason they haven't been vaccinated, they are being offered a vaccine. I just want to circle back to something Dr. Kim said, which is we are now at the point where it's a lot of effort to get to relatively small numbers of people, and that's just where we are. But, you know, among us, all of us working on this, I just feel like that's worth acknowledging, that this is a slow going part of it, and we have to somehow support each other and keep the morale up, because it requires a lot of energy and resources and staff. And then, as some people have said, you're running events and you're getting 5 or 6 people, but we need to get to those 5 or 6 people. So it's sort of keeping the spirit and energy alive is part of where we are right now. That's my sharing.
Thank you, Ralph. Are there any others who would like to share what you're doing? I can't see everyone at the same time. Any other hands? Okay.
Looks like we're good, Kimmy. We don't have anybody else who's raising a hand. I think Dr. Carey was on. Donna, did you want to add anything? If not, we can move to the next part of the agenda. All right. I think we're good. Anything else, Kimmy?
Nope. That's all for me.
Great. All right. Well, let's move on to county vaccine updates and Anika Chaudhry. Anika.
Thanks, Greg. So actually, as a special guest presenter today, we've got Dr. Moss with us, who's our health officer. And there's been, some rises in cases recently. And so I wanted him to go over the first few slides here. If you're on, I can run the slides for you.
Thank you, Anika. Good evening, everyone. And so as I think many people are probably aware of now, we are seeing really actually quite substantial increases in our reported cases. In recent weeks, we were at our low point in late May and early June, very low case rates and low hospitalization numbers. And it's kind of a steady climb in June. And then in the last few weeks, we've seen the kind of increases that we see in the beginning of a surge. And so we've already eclipsed what was our kind of small spring wave. And I'm certainly expecting something at least like what we saw last summer at this point in terms of case rates. This is probably driven first and foremost by reopening and changes in mask use, but certainly also the Delta variant, which is now the predominant variant amongst sequences, amongst specimen sequence in California, 5% in June for the state as a whole. And of that 5% sequence of all specimens, and of those, now it's above 40% are Delta variant. This is similar to what's being seen nationally. And of course, we have, very good vaccination rates overall, but certainly parts of the county where those rates are lower. The highest local case rates do correspond to neighborhoods where, first of all, where we have seen the worst impacts of COVID throughout the pandemic, but also areas where our vaccination rates are lower. And even within our priority neighborhoods, the highest rates we're seeing right now are in East Oakland, West Oakland, and in Ashland, Cherryland. Our daily case rate is over 5, but frankly, it's rising quite fast. And I think, it'll be changing day by day for the time being. We are averaging over 90 cases reported daily. I wrote this slide yesterday. There was 183 cases on 7/9. That number has been revised upwards, so I think it's like 193 now. And we've had several days with reported cases in that range. Test positivity higher, 1.9%. This is with a lag. Test positivity in our in census tracts in the county that have scores on the Healthy Places Index indicating the greatest socioeconomic disadvantages, test positivity was 3.4%. So again, trends that we have seen before in prior waves repeating themselves here. Hospitalization, I still holding my breath and hoping that our hospitalization numbers do not increase to the extent that we saw, for example, in the last summer surge, certainly not what we saw in the winter. We're in the mid-60s right now. That is held steady for about a week, although there's typically a lag, and our greatest increases have really come in the last week or two. So we'll see what happens with this number. Testing numbers have stabilized somewhat in around the mid 4,000 range for the whole county. And certainly, I think with exposures going up, more symptomatic people, that may be part of why testing is going up, or at least holding ground and not decreasing further. Next slide, please. So, when I made this presentation was a couple days ago, and I wanted to show the context, which is, we're still at very low levels compared to where we were certainly in winter. Here at the far right of the screen, this is daily reported cases. But to be honest, now we're up a little bit higher than that, up around 200 and rising. So still not like what we saw in winter, but certainly concerning. Next slide. I think, did we miss one there? Yeah. So just a few comments on Delta. I mentioned this statistic earlier. We don't have a good denominator. We don't have the total number of sequence specimens for Alameda County as a whole, because not all labs report every sequence that they run. We do have that for our lab, but it's a bit slow. I don't have the June data yet. We know that at least 3% of specimens have been sequenced in 2021. Generally speaking, the patterns here for the data that we do have are very similar to what we're seeing at the state. There's no reason to expect we would be any different. It's really been Delta is the story in June. And then Delta is, there's good data to suggest that it's more transmissible than Alpha, which was the UK variant, which was more transmissible than the virus that was circulating earlier in 2020. And so we are talking about a virus that spreads more easily between people, which is likely explaining why we're seeing the amount of transmission that we're seeing now, even given how our relatively high vaccination rates. So it's not just reopening, but really it's this virus that spreads a little bit more easily. There has been some data to suggest that Delta can cause more severe disease, some data on hospitalizations in Scotland, but that hasn't really been confirmed by other published studies that I've seen yet. That would be in unvaccinated people. And the other thing that so far seems to be the case is that the vaccines retain their efficacy against Delta, or at least we have evidence to support for Pfizer most strongly, to some extent for Moderna, which is a very similar vaccine to Pfizer. And then Johnson & Johnson, we just have some laboratory data from the manufacturer showing that it preserves their immune responses in people who have received the Johnson & Johnson vaccine, both cellular and antibody-mediated immune responses are preserved against Delta. So that's certainly encouraging, but we would really like to see more information, clinical information in the real world. There is some concerning data out of Israel showing somewhat lower efficacy of Pfizer against the Delta variant, 64%, I believe they quoted, but preserved, and that is the lowest estimate that I've seen. Most of them run in the 80 to 90% range. But even in that Israeli data, there was, I believe, 94% effectiveness in preventing severe disease. And that's really what people are going to be watching locally is, do people who are vaccinated end up in the hospital with Delta infections? So far, I haven't seen anything to suggest that that's happening. So that's good news. Most new cases in Alameda County appear to be in unvaccinated residents. Some of our neighbors are a little bit ahead of us in terms of their analysis, and my understanding is statewide as well. There are infections reported in vaccinated people. This is to be expected. We have a lot of vaccinated people around. Our population is there are hundreds of thousands, millions of people who have been vaccinated. They are being exposed. The vaccines are very effective. They're not 100% effective. So that means we'll get some of these post-vaccination infections. We just want to, again, if the people are not getting severe disease, not ending up in the hospital after a vaccination, that's really the key thing. And so far, again, I have not seen anything to suggest that that's happening. Counties that have looked at rates among vaccinated and unvaccinated people and statewide, it seems to be the rates are about 5, 6, even 10 times higher in people who are unvaccinated. So vaccines are performing, but we are still seeing this substantial increase in cases. Next slide, please. So, the key messages right now, of course, we want people to get tested if they're sick and of course, to stay home. unvaccinated people really need to be masked up when they're indoors in public spaces, and everybody should be carrying a mask with them because they may be asked to wear them. And I think I don't need to tell this group, but we really do want to continue to strongly promote vaccination any way we can, even if the uptake is lower. I saw there were days last week where 4,000 people in Alameda County got their first shot of vaccine. So, let's keep it going. That's 4,000 is not a trivial number. And just a reminder that, the highest risk settings during this wave, as they have always been, are going to be crowded indoor settings. I think that was it. Oh.
I think we have a couple of questions. Greg,
yeah, Aaron had a question, and then Dr. Rose.
You got it. Hey, Dr. Moss, how you doing?
Good. How are you, Aaron?
Good to see you. I wanted to make sure that I understood what you said. Clinically, have you seen any data that the Delta variant is more severe or deadly despite even being vaccinated?
So I have not seen that yet. I certainly welcome if others have seen that kind of data to please share it. I'm doing my best to stay on top of it. So far, the data, the data that I've seen on vaccinated people is mostly with Pfizer, and so that that means we have some knowledge gaps. But I have not seen anything about severe illness in vaccinated people. But now that the surge is happening, I think now is the time to really be paying close attention. And we are going to try to match data on hospitalized people in Alameda County with our vaccine registry. But that'll probably take a few weeks.
Got it. And is there any inclination of whether we're going to have a booster or not yet? Is any data coming to the county yet?
Well, I will tell you that there are some other parts of the world where I think Israel, most notably, has now recommended a third shot of Pfizer for some populations, people for whom they are thinking there may be decreased effectiveness. The company has gone to the federal government with, to say that they want to, they have data to look for approval for a booster regimen. CDC and FDA last week said at this time, the booster regimens or booster shots are not recommended for any Americans. There isn't data to support the need for that. And again, I think it comes down to, are people who are vaccinated with any of the vaccines ending up with severe illness? And I think that will really change the calculation. So today the answer is no, but I think that this is an area of really active interest.
Thank you.
I think Dr. Rose, did you have a question as well or a comment?
Yeah. Well, two issues. One is I was in Safeway last night and like everybody was unmasked. It was very disturbing. And so I'm just wondering about the thought process on, planning for when we're going to have to put our masks back on, because it's coming. That's one question. And then kind of the corollary to that is, sort of it's not a joke, but I mean, Umoja, in terms of our testing, like we never have any positives. I mean, it's sort of like, it's always a big goose egg for Umoja, but in the last week we've had two, close proximity, similar neighborhood. And both of them were completely, I wouldn't say completely asymptomatic, but like, they didn't look sick and they don't really feel sick. And so I think this kind of dovetails with this issue about masking, because for people who are vaccinated, who could get infected, who have mild cases of COVID, they can spread it to people who are unvaccinated, right? So I just want to know if there's any thought being put into like how we're going to prepare people for when they really do need to put their masks back on, because I think we're coming to something that's going to be contentious. And then the second question is, where are we as testing has dropped off so significantly in terms of the activation of CICT, case investigation and contact tracing? because, I think that probably that apparatus has gotten a little bit rusty. And we've got these 3 folks that we're taking care of on community wellness team right now, which means they're positive, and none of them have received any phone calls. I'm just wondering, about those 2 things.
So yeah, in terms of mask policy, so the state has raised this issue, but there's so far in some policy discussions and kind of dangled it out in front of people. We haven't seen anything yet. They released they had this big schools guidance thing this week. And I don't know if I'm not sure exactly what's going on, if they're just backing off or if it was a timing issue. So we may hear something from the state about masking. I don't know, I don't think it will be, let me put it this way. I don't think that it'll go back to where it was, where they're simply required for all people in all settings, but it may be more along the lines of what LA has done. And if not, if that doesn't happen, I can tell you there's certainly regional, it's something that we're aware of regionally, but I think, everybody is trying to manage the situation in a way that is going to, I think, be as clear and straightforward for community members as possible, because it will be complicated and contentious, as you mentioned. And then the other question was about CICT, and I think Donata is on and maybe coming on. Is she presenting next?
Not next, but she is on. Donata, did you want to answer the question, or did you want me to speak to the issue of CICT?
Yeah, I can share a little bit about CICT. Currently we're still working closely with our CBO contracts, and we are looking at continuing that in the fall. As Dr. Moss has mentioned, we are seeing an increase in cases. So right now we do have some surge capacity within the health department of bringing back staff to help with that. But yeah, I can talk a little bit more about that too later when we talk about the COVID division.
Yeah. Minnie, what I would add to that is that a lot of our teams who have been trained to do CICT, including our community-based partners, are out vaccinating folks. And so we've essentially had to, and this is what we want to see moving forward, ask people to pivot to keep some of their staff still out vaccinating, but bring some of their folks back to the phones to call people to be doing the case and contact investigation, because we have to really do both in tandem right now with the cases increasing and still with those communities of people who remain unvaccinated.
I wanted to alert you that we have an attendee who has their hand raised, so I'm going to put them up in the queue. Audrey?
Hi, Audrey Momo, Office of Senator Nancy Skinner. I just had a follow-up question on Dr. Rhodes' question. Seeing that the case rates are continuing to be disproportionately felt in our communities of color, especially East Oakland, West Oakland, and that they are more likely to be our frontline workers in the absence of, I guess I'm wondering if you don't get guidance from us at the state level on moving to recommending everyone wear masks, would the county look into doing that, just to make sure that we're not putting people who've already bared the highest risk still at higher risk by waiting and seeing?
Well, thanks for the question, Audrey. I think we would never rule anything out in terms of, taking action to protect residents. I think in terms of workers and workplaces, also there is still, the OSHA, but in terms of like customers and members of the public being in certain settings, I think we would, it would be of critical consideration. Let me put it like that.
All right. So I think we've got to keep us moving, maybe if I could keep going, and then because we've still got a couple more presentations. So this slide is just something we created as a messaging piece to remind people to, there are many reasons that people wear masks. And so one, we encourage people to bring their masks with them, and also know that there are some people who are going to continue masking even if you're super vaccinated and don't feel like it anymore. So in terms of the vaccine data update, I'll just go through some of these slides before we go into the youth vaccination piece. So as of this morning, we're at about 70% of our population over the age of 12 fully vaccinated, and about 82% with at least one dose. And as you can see, I think testament to what you all were sharing at the beginning in the partner updates, we're really seeing this curve plateau here. And it's the slow moving increases there. In terms of overall race and ethnicity differences for vaccinations, we've made improvements in all groups. However, Latino and African American groups continue to have lower rates of vaccination compared to our other residents in the county. The last time we were here, we also talked about looking at Census Tract vaccination rates. And so this map just shows overall in the county by Census Tract, the percent of the population over the age of 12 who's vaccinated with at least one dose. And so you can see that, there's a fairly good coverage throughout the county, but there are pockets where the darker the color, the lower the vaccination rate. And in terms of, how we want to prioritize in terms of the pop-ups and where we're putting our resources to really get people vaccinated, our team has worked to combine some of that low vaccination Census Tract data and overlay it with the number of, so we've done prioritization for African American populations and for Latino populations. So this map shows, in these tracts that are highlighted in the light blue, those are census tracts. It's the top 10 census tracts that had low African American vaccination rates. So meaning less than 50% of the African American population in that census tract had at least one dose. And there was the greatest number of African American residents who needed at least one dose. So that's more than 900 residents needing a dose in those tracts. And so these are tracts that are prioritized for outreach, for mobile vaccination efforts, et cetera. And I think that maybe Kimmy or Sandy could talk more to that when we go into the later pieces, or we can bring you back more updates on how this work is panning out at the next meeting. Similarly, with the Latino population, we've done the same thing. And so here you're seeing the top 15 census tracts, meaning that this is places where less than 60% of the Latino population has at least one dose. And there are more than 900 people identifying as Latino or Hispanic who are unvaccinated in each of these census tracts. And so in both of these areas, it follows our priority neighborhoods that we've been tracking throughout the pandemic. But with this one in particular, it's gone a little bit further south into Newark, over into Livermore, the Dublin area as well, and Union City. And so again, same thing, this is a priority for all of our efforts related to vaccine. And so in terms of reaching unvaccinated residents, we're continuing to partner with organizations that are serving the most highly impacted communities. We're launching a new door-to-door outreach effort in the highly impacted neighborhoods. And that's in partnership with our Outreach and Health Education Network that's been with us for quite some time now, as well as community navigation and navigator partners who've been a big component of the vaccine work. And then we're also sharing this info with our board staff and the city staff, as well as other communications, so that everybody knows sort of what the highly impacted neighborhoods are, and to get the word out. And then, as you all have talked about, just being as convenient as possible and having pop-ups in neighborhoods and vaccination in neighborhoods and wherever people are. We're also using those same census tract maps to help us target media and social media outreach. So both with ethnic media and with Facebook messaging or with Twitter messaging, we're able to get messages in different languages to those areas saying, like, here's first vaccine available, here's other health promotion messages as well. And then I think you'll hear more about this in the youth update a little bit, but also working with youth to create content and relying on trusted messengers in that space, partnering with school districts, and supporting independent physicians to distribute vaccine. And then finally, partnering with the California Department of Public Health and the Public Health Institute to reach additional community and work settings. And so this is where the state, for example, has set up a system where employers who are looking to get their employees vaccinated can make a request to the state, and then the state works with local health department to send out folks to say, so that we're coordinating with them on sending people to certain workplaces to get people vaccinated. And so I will stop there and turn it over to Lisa.
Good evening, everyone. I'm going to talk a little bit tonight. Before I get into the youth vaccination, I thought I'd talk a little bit about what's been happening around guidance. It's been a really busy week. The California Department of Public Health released their school guidance. Everyone was waiting with anticipation for this guidance. So it was a big day. So we're just reading through it, learning a lot. They're also, just to give you a quick summary, the guidance, as well as Alameda County, is prioritizing in-person education. So they're really, the emphasis is to get as many kids back and in-person as possible, which is one of the reasons why they are requiring masks indoors for everyone in K-12 settings. And the other reason for that is that they don't have a distance requirement anymore. So it used to be strong recommendation for 3 to 6 feet distancing. That's no longer a recommendation. So that's even more important that there'll be masks worn by everybody in K-12 settings. They've also modified their quarantine options to make sure that when kids are exposed to a positive case, when students are exposed, that they won't miss too much classroom instruction. And they've developed a pretty lengthy guidance document around testing. So a lot of different options that weren't available before, and just more guidance around when to use testing, how to use it. So we're definitely going to be reading through that and helping our, in partnership with Alameda County Office of Education, really helping our schools and districts learn about those testing options, and also in partnership with our testing team here at the Public Health Department. And let's see, and we'll continue to align with California Department of Public Health. And just to remind everyone, we have a team, the Safe Learning team, that helps answer questions from schools. And we continue to partner really closely with ACOE. What's not on this slide is that childcare also, we've been working really closely with our emergency childcare planning team. And we've been doing some webinars with them for childcare providers, because they also have new guidance that was released last week. So it's been a very busy couple of weeks for our youth settings. Next slide, please. So now on to youth vaccination. So this is our overall vaccination data. So we've definitely seen an increase, which is great, over the last few weeks. This was data from last week. We're at about 63% for at least one dose, and almost 50%, or about half, are fully vaccinated. So that's going up, which is great. Next slide, please. And this is the data by city. And as you'll see, there's a pretty big disparity between, Piedmont, Albany, Berkeley, Dublin, these cities over on this side of the slide, versus Hayward and Ashland and Cherryland. So we have a lot of work to do in decreasing that disparity. And then this is, similar, this is by, fully vaccinated. And this is by race ethnicity. So you can also see some of those disparities here. Again, it's similar to what we're seeing in adults, really trying to focus on, African-American, Black, Latino, Hispanic, and working in Pacific Islands, so really working on those specific race ethnicities, try to get the word out. And hopefully with what we're going to talk about in a little while with our youth vaccination efforts and our work group, we can really help with narrowing these disparities, these race ethnicity disparities. Next slide, please. And as you can see, it's similar for fully vaccinated. So I'm going to talk now a little bit about our youth work group. I don't know if some of you remembered a while ago when we launched this work group, we had many attendees or members of this community advisory group joined our work group. So I want to thank all of them. It's been a pleasure to get to know everybody, and we really, developed relationships with these folks and got a lot of feedback and learned a lot as we worked together. It was a diverse group. We had representatives from health, early care and education, K-12 educators, and youth development organizations, the faith-based community, and most importantly, we had a group of youth leaders that joined our group as well, which was awesome. And we're going to hear from one of our group leaders in a minute, or youth leaders, excuse me, in a minute. And we had 3 meetings, and what we focused on was reviewing the data that I just showed you. We reviewed that at every meeting. And learned a lot from each other, and really just kind of heard what people were seeing and hearing from youth and community members. And lastly, we developed a work plan and worked on prioritizing that work plan, and that's what we're going to talk about on the next slide. Oh, you can go ahead. Next slide. So this is our youth work group plan, and we came up with 3 goals. The first one was increasing youth vaccination rates countywide, obviously with that equity focus. And part of that is just really being able to look at that data, that youth specific data on a weekly basis. So we've already been doing that. We get that data from our team weekly and, look at that data and share it with, we work very closely with Alameda County Office of Education to work with school districts, especially in those cities where the rates are really low. So we've already started to implement that goal. And then the last goal we're going to start working on as well, which is planning for the youngest kids when that vaccine is available. I believe they're looking at maybe late fall. We don't know for sure when that might be available, but we are going to be starting that plan as well. But I wanted to hand it over to Sahar Khan, who's going to share a little bit about one of our most important goals here, which is developing the Kovacs Youth Outreach Plan. Sahar, I'm going to hand it over to you.
Hi, everyone. My name is Sahar. I am the programs director at Gcea, and Gcea stands for Global Communication, Education, Art. Our organization provides resources that support the Pan-African community in Alameda County and around the Bay Area. We take a holistic approach when it comes to supporting our community. That means we offer a wide range of services to our clients, and they can come to us with any issues they may be facing. We offer support in regards to housing, rental assistance, legal support surrounding immigration, and we also run a transitional housing shelter. Most recently, in response to COVID, we have started food and PPE distribution, and we also partner with local organizations to get members of the Pan-African community access to both testing and vaccination sites. As Lisa mentioned, we have been working on 3 goals. I will be speaking about our second goal, which is to develop a Kovacs Youth Outreach Plan. When brainstorming for the plan, our main concern was to offer peer-to-peer youth-created content, which means that the content is developed by youth for youth, and the conversations are led by youth leaders within the community. Our goal is to offer young people a chance to facilitate their own messengers and organize a way to disseminate information about the vaccine that resonates with them. I'm a proponent of youth-led programs because I believe it gives young people a chance to become active participants and learners when they're given some degree of decision-making power. Programs that are developed and run by youth have the ability to incorporate perspectives that may not be clear to older generations. I've spoken with peers that have drastically different thoughts about the vaccine than older members in my family. Some of the things that I've heard in my community around my friends is that they have fears surrounding the first wave of the vaccine, and who, like, the people that are getting vaccinated now are like test subjects or guinea pigs because it was rolled out so quickly. Another fear that I've heard is that the youth are very suspicious of the incentives that they are being given for getting vaccinated, such as free donuts, cookies, etc., Six Flags tickets. So the youth often get their information from very different sources than adults. I know the majority information that I get on a day-to-day basis comes from Instagram and Twitter. And there's an entire world out there right now of memes dedicated to COVID and the vaccine. So it's kind of like it's difficult to reach a population that we don't know a lot about. So what we've come up with together is a youth-led communications work group, which will be facilitated by youth and include all youth members. This work group will be led in partnership with a community-based organization that's local to Alameda County. All the youth and members of the Youth Kovacs subgroup have been invited to participate, and others are welcome to join as well. I know a few youth who work with Gcea are here today, which I'm excited about. So we're still working out the details regarding dates, but we plan to start this youth-led work group in July, which we hope will give us the ability to uncover the true attitudes that youth have right now surrounding COVID and vaccination, and allow us to then address like issues that we hear about, while also empowering our youth and facilitating leadership development. Thank you.
Thanks so much, Sahar. Thanks for joining us, and thanks for participating in our youth subgroup. And Sahar, I believe you're also going to continue to participate in the communications work group too. So thanks so much. Okay, next slide, and then we'll open it up for questions. So this is just the last slide, which is our work group next steps and recommendations. Our first step was to present to you all tonight to let you know what our plan was, and then the following is what we'd like to do in the future. So we would like to incorporate this youth vaccine planning into this overall community advisory group in the future, rather than having a separate subgroup. So at these CAGs, we would present the youth data and provide updates and get feedback at this overall CAG meeting. And then, as Sahar mentioned, we want to have we plan to launch this youth Kovacs communications work group, which is going to be, as Sahar mentioned, peer-to-peer and all youth created content and led by youth. And let's see, we also want to make sure that we continue to have very close feedback loops with that communications work group. So all the content that's developed, we can bring it back to the CAG, and we can have, hopefully the CAG can help us with the dissemination, and we can really work together to increase our overall vaccine rates for youth. And lastly, we also hope, as part of that work group and all of the, the partnerships that we have here at the CAG, that we can develop more of a youth ambassador program. So, really focus on, developing youth leadership and, trusted messengers that are youth that can get out there and help develop the messages and also disseminate those youth messages. Next slide. I think that was it. So I don't know if anyone has any questions.
Hi, everybody. Yeah, thanks, Greg. I don't actually have a question. I just wanted to kind of clarify things and link two things together. So early on in the partner updates, Dr. Kim Rhodes was talking about the Umoja effort to hire youth ambassadors to do the youth created content and really do deep penetration in communities across Alameda County. And what Lisa and Sahar are just talking about, we're weaving those two things together. So really, we're going to work very closely with Umoja leading the youth development training aspect and the internship process for youth content creators. And the Healthcare Services Agency is going to partner and support with youth leaders and some of our staff to work with Umoja to really get this youth content creation work group together. So we're really excited about that. It's moving fast and furious. And there's been multiple partner meetings already between when the work group came up with this and then Dr. Rhodes reaching out and saying, hey, we got to do this thing. So it's been beautiful synergy. We're really excited to be partnering with Umoja and some other community-based organizations in this youth content creation effort. So more to come on that. And we're really looking forward to the leadership of Seher and other youth in this effort. So just wanted to link those things together.
Thanks, Tuuri. And I just want to thank Tuuri too because this work group would not have been possible without Tuuri's help. So it was great working with you on this. Thanks.
Yeah, this is Greg. I got a question for Sahir. First, thank you for all the hard work that you're involved with. No, Alma's, I think you're in the same group as Alma's, I think. And so the question I have for you, and I really appreciated what you said about the source of information for a lot of young people. I have a 12-year-old who, she didn't believe anything I say. It's sort of like, it's always somebody else. And so here, I'm just curious. I know that you mentioned that the source of information for a lot of young people are social media platforms. So Instagram, Twitter, TikTok, that sort of thing. Who are the most trusted messengers, like real live people for young people, in your opinion? Who are young people listening to the most?
So I think right now, I was just talking about this, is young people really look up to people that they I think want to be like athletes in the community. I think that would be a really good point. Just people that they trust and also look up to, and maybe a lot of influencers whose lifestyles they want to emulate, to just come out and have meaningful messages surrounding COVID and getting vaccinated, and moving away from kind of like propaganda surrounding it versus, because I don't know if you guys know that there's like some music videos about COVID vaccines and things like that, and youth share them, but it's not really like informative. It's more of like, look at this, it's kind of funny. So moving towards like more meaningful messages of trusted people in the community, just saying like, I've been vaccinated, here's my experience with it, I've done it for my family, and whatever they really feel.
Okay. So one little follow-up. So local athletes, are you talking about people like Steph Curry, or is it more like national figures like Serena Williams, or is it both?
I think either one, and maybe even people in the community. I know a while ago I went to a press conference for gun violence information, and Mr. Fab was there, and I think he made a really great speech, and it really resonated with me. And Mr. Fab makes music for the community. He also does a lot of community outreach, so it was something that was very like eye-catching and also attention-grabbing for me. I was like, oh, Mr. Fab is here. He believes in this cause. I connected with him after and like tagged him on Instagram. So I think that that's a great way to get the message out there.
Great, cool, thank you. Yeah, I was at that press conference too, and he did a great job that day.
Yeah, he did do a good job.
Yeah, cool, thank you for that. Other questions, comments?
If I may, Greg, I know that Lisa, shared her gratitude with me. I just really want to underscore the gratitude of this work group. I was so impressed with the level of commitment, engagement, and what this work group was able to accomplish in 3 meetings. I know sometimes these things can go on and on ad nauseum, and this really did the work. This work group did the work. So we're really grateful, and we're really looking forward to the next phase of youth leadership and reaching young people in this county with the COVID vaccine. So just many thanks to all of the work group members and all the supporters behind the scenes. Thank you so much. And special shout out to Lisa. Back at you.
Okay. So I'm going to talk a little bit about what we are seeing or what we're thinking we're going to be doing moving forward. As we've been saying, we are not out of this yet. And so we in the health department, we are really looking at this as an opportunity to strengthen our foundation and prepare for being at this for a while. We believe that our data will continue to resemble patterns in California as a whole, that COVID, unfortunately, will continue to circulate, particularly among unvaccinated people. The vaccines are, as Dr. Moss mentioned, proving highly effective in the real world, but a booster campaign is still not totally off the table, but there's more to come in that arena. Next slide. As we spoke earlier, we really are continuing, all of us together, and that's really what this work group is about, to continue to work at getting more people vaccinated. It would be great if we could get very close to 100% vaccination. Public education, as was discussed by Seher and some of the others from the youth work, as well as reaching other populations, is a key aspect of continuing our efforts to provide information, really good, clear information to people about the benefits of getting vaccinated, about the vaccine itself, and about COVID. Next slide. In addition, we haven't, I think Dr. Rhodes mentioned this earlier, talked a little bit about testing, and we shared some of our data about testing. We believe that though there is a vaccine, we still need to keep our testing apparatus, particularly at the community level, in place and available. And although we had really backed off some of our isolation, quarantine, outbreak response, or case and contact investigation work, because our numbers had really gone down, we need to always be at the ready and always prepared to ramp that back up should numbers go up like they're doing now. Also, significant portions of our COVID response, as indicated by some of the people who've spoken here today, really are carried out not just by the health department, but also by community-based organizations throughout Alameda County. Our system is not just a county system and a county-based system. It is a community and county-based system, and it really takes all of us to do this work. Next slide. And so for our moving forward, our 2-year strategy, and yes, I'm saying 2 years because this is really about also investing and strengthening our public health infrastructure for the future. And so we will continue to strengthen our ability to prevent COVID infection, transmission, and serious illness, to continue testing people, isolating people, and supporting people who get sick. Also, we really need to continue and even do more in this area to redress the COVID-19 related racial and ethnic health disparities. There were social inequalities and disparities that really drove where we saw COVID. We will also see the impacts of COVID, and those impacts will not be equal across the board. We will see them more heavily in certain communities, and we really need to pull together solutions to address the impacts that we're starting to see already. And last, really using this opportunity to strengthen our public health infrastructure, as well as to evaluate what works. Next slide. I'm not going to share all of these strategies. These are some of there's a lot here. Some of the strategies that we are using currently and will be using moving forward. And this is just to share with you all the work that we are planning moving forward. much of this work reflects work that you all are doing as well in your organizations. And so this is what we collectively will be engaged in to manage COVID over the next months. Next slide. And for that purpose, we are shifting out of an emergency response mode, so to speak, and are really institutionalizing our COVID effort. And we have stood up a COVID division. Donata Nilsson is our new COVID division director. And I would like to ask Donata to give a brief overview of the division and the things that she'll be holding moving forward.
Sure, thanks, Kimmy. So as you've heard throughout this evening, we will continue testing. Testing is one of the crux really of our activities. We need to identify cases so that we can make sure that they are contacted and they're able to isolate and quarantine the contacts. So that the testing unit is one of our main activities. We also have our disease containment and community vaccination, as Kimmy mentioned. We were in a response mode where we were focused on disease containment, and now we've really pivoted to focusing on community vaccination efforts as part of our disease containment efforts. Our outbreak investigations, again, it's really looking at what types of organizations or what kinds of facilities are having outbreaks, and we have specialized teams that are able to respond to different types of settings, for example, workplaces and healthcare settings, and children and youth and congregate settings. So we have 6 outbreak teams that will continue to be able to respond to any types of outbreaks in our county. And then we also have our case investigation and contact tracing. Kimmy talked about that a little bit more. Again, with a lot of support from our community organizations who are also assisting with some of that work. And of course, the data and epidemiology, we constantly are looking at data to understand, what the numbers are, how many cases we have, how many outbreaks, but then the epidemiology part is really to look at who are the affected populations, looking at race and ethnicity and other factors, who are the individuals that are, being affected by the COVID. And then health promotion and communications is consistently a key part of being able to message appropriately to our communities and to our affected populations, so that they can also be part of the response of this pandemic. So it's really a whole community effort. And then just to give you a couple of examples of some of the work that we're continuing to do, we are continuing to send out, for example, work exclusions so that people in sensitive or high-risk settings are not going to work, and they need to isolate, make sure that they isolate at home. We continue to send hard copies to individuals, isolation and quarantine packets to individuals so that they get the information at home if we're not able to reach them by phone. We continue to, we have the COVID vaccination line. We also have an inquiries line that we continue to get questions from the community, as well as from our healthcare providers. We continue to track infections of concern, for example, if there's any post-vaccination infections or any repeat infections, so we can keep track of that information as well. And of course, you heard Dr. Moss earlier talking about the variants of concern, the Delta variant being one of the variants we're keeping a close eye on. So we track all of the variants to see if there's a certain variant that is making, that is increasing. And then of course, we continue to keep a very close eye on our long-term care facilities, our skilled nursing facilities, who are a very vulnerable population that we very closely monitor, and we provide technical assistance to as needed. So we have a team dedicated just to our long-term care facilities. And then of course, we continue to work with our correctional facility partners as well. So as I mentioned, we have 6 teams, outbreak teams that continue to monitor. So that's kind of just a snapshot of some of the work that we'll be doing in our COVID division as we move forward. And just to share as well, when we are not as busy as we have been the last several weeks, maybe a month and a half, we haven't seen as many cases or as many outbreaks. We've been using that time to cross-train between the units so that if there is a surge, that there's multiple people that can pivot to where the need is.
Thank you, Donata. And you'll be hearing more from Donata moving forward as we continue coming together. Next slide. And so I wanted to introduce briefly some changes that we would like to get your thinking around. And we can talk more about this in our upcoming meeting. But we are proposing to continue monthly meetings through December and reevaluate at that time. Also, we'd like to, as we've been talking about, we'll go through periods of very low cases to a wave. Now we have vaccines, we need to keep testing in place. And so what we really want to do is to be able to have broader discussions here related to COVID. And so although we started this group specifically focused on community vaccination, we really would like to expand the content of this group to cover the full range of COVID activities. And we always talk about all aspects of COVID, but to officially really hold all aspects of the COVID response is what we are proposing that we do moving forward so that we can focus on recovery and resilience, community coalition work, continue talking about our vaccination work, continue talking about and discussing and identifying solutions around certain populations, whether they be youth or African Americans or the Latinx community. And as always, we want to take a look at if there are groups that are not part of this group currently, and should they be invited to participate. So, because that really makes the work that we do collectively better when we have diversity of perspectives here in this space. And so I'm going to pause just to get some thoughts and some feedback. And I think Nestor is going to maybe facilitate a couple of questions. Again, we will come back to talk more about this, but just wanted to present to you what our plans are for moving forward and just get some initial reactions. Thank you.
Thanks, Kimmy. So any initial thoughts on what was presented or any questions based on the strategies that were presented by Kimmy or Donata? And I'll take any hands. Let's see if I see any. I think I see Aaron's hand. Go for it, Aaron.
Hey, team. No, I think definitely on the right track with the strategies that we need to be considering. I think we said it in our last meeting, right now testing may be out of style, but it's going to be in style pretty quickly. And not that we wanted to, but I think considering that we're coming up on flu and cold season as well, if someone is sneezing or coughing, that can be confused for a virus as well. And the other caveat now, facing the Delta and alpha variants, that's a whole nother gamut to worry about. I think also with the 6-month-and-a-half-year-olds to 11-year-olds too, soon we're going to have to worry or have a strategy to make sure that we're vaccinating them as well, because Pfizer and Moderna will come out with the vaccine that qualifies them to become vaccinated. So those are all things to consider. And I think that as the ground continues to shift underneath us, those are going to be areas in economies of scales that we have to worry about, both, county and your community partners to be ready for. Something that we've seen at the vaccination clinics is exactly that, right? On economy of scale, whether you vaccinate 20 or 150 that day, the staffing that it takes is what it takes. We were in Deep East Oakland a day at Homies with street level as well. Public health was there, so thank you always for your support. But that's the amount of staffing that it takes. And again, the road will be long. So I appreciate a 2-year lens, because that's what it's going to be, block by block. So thank you. If I may, before I get cut, just wanted to say thank you to Dr. Rhodes for your thought leadership. Greatly appreciate you, Dr. Rhodes.
I will never cut you off, Aaron. You have as much time as you need, unless we run out of time. That's when the time, and that's not my choice. There are a number of good questions or comments in the chat. I encourage you all to take a look at that. Right, asking about nurses, if there's a Black Nurses Association, connecting with some of the youth commissions, which would from different cities. So I encourage folks to take a look at the chat and to add comments if you have any additional information to share there. I think we do have time for at least 1 or 2 more questions or comments. So I
We
encourage
also
you to
have a video though, Nestor, sorry.
Sorry,
so I
no,
make
okay.
sure that we leave time for that video.
While we queue that up, I want to acknowledge Maria Good-Costin from the African American Wellness Project, who is volunteering to join the Community Advisory Group. So we will be in touch with them.
Yeah, there are a lot of good ideas being put in the chat of people who should be included as part of the Community Advisory Group. Thank you.
Any last questions or comments before we turn to the video?
Hi, everybody. This is Paula Zuniga. Can you hear me?
Yes, we can hear you, Paula. Go ahead.
Muchas gracias. I just wanted to lift up our campaign, that day labor's vaccination campaign that we've been carrying out since early June with Street Level Health Project and La Familia. We've vaccinated 419 so far, day laborers, and the gist of it is that all these folks, the majority of these folks are indigenous communities from Mexico, Guatemala, and it is a variety of languages. We've encountered, primarily Mom, but there are variations in depending on your your community where your original community, and for that reason, like Quiche, Maya, Yucateco, and different in Guatemala, there are different communities that speak different languages, so, or a different mom language, I should say. And one of the things that we're in our effort, in our process, in our work, we're learning a lot from these communities and the way that health education, vaccine choice, and navigation is a process of there's warm handoff every point. So I wanted to lift up the needs, the language access needs for these communities, the health education, and the vaccine education needs, and information, the need for clear, accurate information that they can make the best decisions. So just wanted to lift up this work at this table, because we do have a very strong and engaged and a presence of immigrant indigenous communities in the county.
Gracias, Paola. Thank you, Paola. It's always important to lift up that piece and how we're thinking about language diversity, not only for, I think our immigrant communities, but folks that we may not be thinking about as well in terms of how we're reaching and how we're communicating with folks across a variety of different ways of speaking and thinking and processing information.
Absolutely.
So thank you for lifting up that point for us, Paola. Do we have time for one more, or should we turn to the video?
I think maybe the video.
Okay. Yeah, let's do that.
So the video is about 4 minutes, or a little bit over 4 minutes. And thank you to Gabriela for sharing it. And it sort of highlights this great project that Paola was just highlighting and that Aaron and Gabriela talked about earlier.
And Anika, I think we have time to play about 1:50, and that will capture the essence of the video message.
Okay.
Which is a
I'll also
great
throw the link in
segue.
the chat. Yeah.
Yes.
Hey, I'm Vasily Kapila. I'm with the Alameda County Department of Public Health COVID-19 Testing Task Force. Today we're working with Street Level Health, with the Health Equity and Planning and Policy team from Public Health, as well as La Familia, to provide a 2-day event for predominantly day laborers, but also the surrounding community in the Fruitvale. And what's really special and important about this event is that there was a ton of work done on the front end to actually do an event that meets the needs and the wants of this community. It was designed in a way that would support what would work for them. We also wanted to make sure that food, water, and things that they need were here. We also wanted to make sure that there was a lot of support in their language and in their cultural relatability to the questions and the concerns that they have around vaccination.
Hi everyone, my name is Gabriela Galicia. I'm the Executive Director of Street Level Health Project, and today we're out in the Fruitvale community trying to get our community vaccinated. Being the fact that, a lot of day laborers are waiting out at a street corner 8 hours a day, 7 days a week. And so if they get vaccinated or have to receive a service, that means losing a day of work. And the pandemic really has hit them pretty hard. There hasn't really been a lot of job opportunities. So we felt the need to come out here and bring them to them where they are at.
Blessings, everybody. My name is Cesar Cruz, and I represent an organization called Homies Empowerment. We're so proud of La Familia for being here in the barrio, in the community, in partnership with Street Level Health and also with the county. And what's so beautiful is that you see our neighbors, our community coming out. Oftentimes a lot of our folks, what we've seen in the line is folks are really worried. And so hearing what's the difference between Moderna or Pfizer and J&J, and am I going to get any side effects? And hearing all of these things on the news, it's important that organizations like La Familia and Street Level be here to dispel those myths and get the resources to the people. So we're here in solidarity. We love what they're doing, and we're just here to support.
Yay, ya me vacuné.
Sorry,
What's
Aaron,
cool-
I didn't get to your part, but
Oh, I don't care. I don't care. As long as you guys caught that, that's beautiful. And one thing to say is Street Level and La Familia and Public Health, we're out at Homies Empowerment today in Deep East Oakland. So really targeting those areas. So thank you.
And we'll put the link to the full video in the chat, and it's also being shared through our social media. So encourage you to share with your networks. And you can catch us at Dare to Be Well. I'll also put a link to our social media in the chat. So it is 7 o'clock now. We are concluding our meeting shortly. Who would like to take us home?
I think that's my job today. I want to thank everybody. Maria did a great job today. First time out, I think, on this in your role today. Thank you. And thank everybody. So I want to thank all of our interpreters, translators, and most importantly, all of you who are doing the work on the ground. We really appreciate you keeping up the energy and the effort. And we know that because of you, our community is safer and healthier. So thank you all very much. And we will see you the next time.
Thank you, everyone.
Thank you, everybody. Thank you to all our interpreters, our captioner, our note taker. Good night and see you at the next meeting.
Good night, everyone.
Good night.